So my name is Professor Johnny Moore and I'm the Medical Director of Cathedral Eye Clinic here in Belfast.
And my name's Mr. Niraj Mandel. I'm a consultant ophthalmic surgeon here at Cathedral Eye Clinic. Johnny, we're one of the first groups in Ireland and the UK to start using the new CAIRS procedure to treat keratoconic and ectatic patients. Can you give us a kind of summary and understanding of what that involves and kind of a summary of the good results we've had so far?
Keratoconus is a condition which really causes a misshaping of the front window of the eye, which everyone looks through. And it does so in a way that means that glasses are not able to correct one's vision. So one has to try to address this really in a couple of ways. One is to prevent the progression of the pathology, that is stopping the cornea getting more and more misshapen. And the other aspect then is can one change that bad shape and improve it and turn it into a somewhat better shape? Now, there's been quite an evolution in forms of treatment for keratoconus over the past 15 years or so. The first being, which was a real seminal change, was the introduction of a treatment called cross-linking, which was where you were able to cross-link the fibers in the collagen fibers between those in the cornea, and that would strengthen the cornea and stop its progression. The difficulty with that is that it often leaves the cornea really in pretty much the same shape that it was, which is a bad shape. And so the whole drive from the introduction of cross-linking is an attempt to understand, can we actually improve the corneal shape as well as stopping the progression of the pathology? So there are different attempts that have been made at this, but the CAIRS, which is really the term means corneal allogenic intrastromal ring segments. And this was a very clever idea by Susan Jacob from the Agarwal Center in India, where she thought, let's try to take actually corneal tissue, that is transplanted tissue, let's make it the shape in the form of an arc, and let's insert it into the corneas in a similar way into which we had been putting plastic rings before. And plastic rings had some benefits, and they did improve the corneal shape, but there were also lots of problems with it. And so we've been using corneal tissue in the form of full thickness corneal grafts for some time to treat keratoconus, and also partial thickness grafts, but this was the first time that these arcs were made. So we're very happy, that we've been able to introduce this, and we've now carried out a few cases within our clinic, and to date we're very happy with the results.
I think it's important that we kind of emphasize that we've found it relatively easy to put these implants in. We've been using the femtosecond laser to make a small arc tunnel, and then taking the patient to theatre and then putting these in using relatively easy instruments to use with quick recovery times and low rates of inflammation, no signs of rejection, and really impressive regularizing of the surface, as we've published in a few of the images that we've put up online so far.
Our initial results are very exciting. Obviously, we've only done a few patients, but certainly with any new treatment you do, you're monitoring things very closely and trying to see are there any potential problems. But from both our own early results and also those of our colleagues who also have carried this out, we see this as to be a really significant advance. The beauty is that because it's outside of the visual axis, that you're not putting the visual axis at risk at all from as some of the other treatments that were previously in place do. And also it means it also leaves it open at potentially 4 or 6 or months or even further time later to do some fine-tuning if necessary with laser and topography guided laser, where we use a very sophisticated laser to further potentially reshape that cornea. But the bulk of the work has already been done through this CAIRS procedure. And even just on our first results, we're finding on the CAIRS procedure alone, 24 hours later, we've had some really wonderful early visual results noted by the successful treatment of these patients.
And the final point I would like to emphasize is we've had a few patients who have had quite advanced ectatic or keratoconic disease, and when presented an alternative to a transplant, they've kind of jumped at this idea that it's a less invasive and more simple and easy to do procedure. And it doesn't mean they can't have a transplant later on, but they often would choose this procedure that we're offering now over a more invasive transplant procedure.
Yeah, I think what this shows is generally the technological advances which are consistently taking place in our subspecialty of ophthalmology. So we've got basically combining here too, where we're using tissue grafting in a different way, totally innovative and new way, but we're also combining that with traditional but really high-end technology which is used normally for refractive procedures to get people out of glasses, and we're using it in a therapeutic way to facilitate the implantation of these new donor grafts. And really it makes it really quite straightforward to implant these with really quick recovery. I mean, a patient afterwards goes up, they don't need a patch, they get up, they walk away as if they'd had a minor refractive procedure.
Yeah. Okay. Thank you.
Okay.
Thank you, John.
Thank you very much, sir.
Thank you, Professor.
Thank you.